Next, I'm excited to hear from the House Democrats on what they are working on, what they are thinking, and where they believe we are going over the next 6 months or so. So joining Sarah today with this discussion, I have Representative Stephanie Young, Representative Stephen Wooden. So Sarah, I turn this over to you.
Thank you. Well, thank you, representatives. We just had a great discussion in the previous panel of how the budget's going to be done here pretty soon. Yep. We're going to have it done on time. I love hearing that. So we get that out of the way, and then you're going to turn to whatever your agenda is basically between now and the rest of the year. So tell me, Representative, what's first on your agenda?
Affordability, affordability, affordability. Folks across the state are feeling the crunch of a cost of living crisis caused by a Congress and president in Washington who decided to defund affordable health care and defund Medicaid to pay for another, in my view, irresponsible tax cut for the rich that, frankly, they didn't need. Or now a trade war that is continuing to jack up prices and place our industries under uncertainty. And then lastly, an actual war, a failed actual war that is jacking up gas prices. People are feeling the crunch of the affordability crisis. And while we cannot fix every problem that's coming from DC, we can do our best to make life more affordable in Michigan. That means making sure we're helping tackle the high cost of housing. That means we're helping expand affordable childcare. As someone who was just in the hunt to find childcare for his 5-year-old and his 6-month-old, I can tell you that is an absolute barrier to the affordability crisis right now. And then, certainly making sure that we are protecting affordable care as best we can, given the cuts from the federal government. We were able to get a lot of that done resolve some of the immediate issues with the affordability or with the Medicaid crisis with last year's budget as part of the budget implementation process, avoiding that fiscal cliff. But we certainly have now longer, lingering reductions that we have to confront on how we can shore up Medicaid and other and affordable health care. So,
and Rep. Young, what's at the top of your agenda?
Ditto.
Ditto. Okay.
But here's the thing. One, I just wanted to be certain to share with you that we're in an immediate crisis, as my colleague just spoke about. But we've known that for far too long, Michiganders have been suffering. And so House Democrats have taken the time to take our show on the road with our vision project. We've gone from community to community, listening to residents. It's not just us sitting on the high hill of the state capitol, but it's us going into our communities, sitting down, kitchen tables, holding community meetings and saying, these are things we think would work. What do you have to say? And oftentimes that voice gets left out because they think, well, this is your job, go figure it out. I'm like, I can't do it. The people sent me. And so when we talk about health care, when we talk about affordable child care, since I've been here during the conference, a gentleman said, my child is turning 4. He said, prior to me having children, I really didn't know what this affordable child care conversation was all about. It meant nothing to him. It was low on the totem pole, and now it's the top of mind. And it's been the top of mind for us as House Democrats. We're going to continue to do that. He's excited about his son being able to start a pre-K. Free universal pre-K, right? That eliminated a $16,000 a year child care bill.
Absolutely.
That's real money back in the pockets of our families. And so these are the things that House Dems are continuing to be focused on.
Well, this issue of childcare, affordable childcare, is incredibly important to individuals, but also to the business community 100%. Here with the Detroit Regional Chamber. Of course, we need to be able to have employees freed up so they can come to work, and so got to have some support there for the kids.
I mean, it's rare when you have a Democrat quoting the Michigan Chamber of Commerce, but their own study was talking about how a lack of affordable child care was costing our state economy nearly $3 billion in lost productivity. We have a child care crisis in this state, and we need to rectify it by expanding options and bringing down costs. Certainly very excited to see the continued expansion of the TRISHARE program that allows the state, parents, and employers to come together to make childcare more affordable and get folks into the workforce. But that's one side of the equation. We also just need to make sure there are more childcare slots and making sure more people are getting into becoming providers, becoming caregivers, so that
supporting those workers in the childcare industry is so important too.
No,
the state has a really strong role in that.
Well, we do, and training them up now and making certain that some of our younger people that are just coming out of college understand that these are opportunities that they have. oftentimes people don't even think that way. And so one of our jobs is to let folks know, particularly these young people graduating from school, that there are different opportunities. Because things are changing. It's not that I graduated from high school in 1983. So in college, a few years later, so much has changed. When I think about my children, I was the one that was taught, you go to school, you get a good job with a pension. What pension? There aren't pensions anymore, it's 401ks. My children are like, well, why does anybody want to stay on a job for 30 years? Anyway, these are different conversations, so we've got to make certain they understand there are different things that they can do, and we need them in the child care space.
Yeah, absolutely. Well, outside of childcare, I know you named off a couple other things. What's teed up and ready to go? You know, in your work with your colleagues in the House and in the Senate, I think, for that matter. What do you think is next on the agenda? Let's say the budget obviously is next, but maybe it'll be in early September or something like that.
You know, certainly housing is a priority we keep hearing from both sides of the aisle, a desire to tackle the lack of available housing, the lack of affordable housing. You know, certainly I think you'll see a wide range of opinions on how to tackle that issue, whether that's zoning reform, whether it's investment, whether it's code reform at the state level for building codes, or some combination thereof. But certainly I think everyone is in agreement we have to do something. Personally, speaking for myself, not as the whole caucus, I'm very intrigued with both the state affordable housing tax credit proposal that Reps Aragona and Grant introduced, that Governor Whitmer highlighted in her State of the State. Also certainly intrigued by the zoning reforms that have been talked about. Looking forward to seeing if there's a potential for a compromise there. And then also some of the building code reforms. I co-authored a bipartisan package around staircase requirements to make it easier to build smaller scale apartments. We'll see if that has any potential.
Yeah.
Again, I think for right now, there's an agreement with, that things need to be done. We have to tackle the lack of affordable housing in this state, knowing that higher housing costs raise other costs, and just trying to figure out what consensus can we bring in this term on housing.
Well, it's just another great issue where you can partner with the business community and talk about affordable housing.
Right.
Detroit Regional Chamber, obviously Detroit is the foundation of that, and I love how you're representing the city today.
Yeah,
and
that's right.
Detroit Tigers looks great.
Yeah.
But yeah, tell me more about how you might work with the business community on affordable housing.
Well, yeah, we have to. One of the things, and I'll tell you, since I've been in the legislature, I've been on financial services committee. And so making certain that people even have access. Once we have the housing, particularly in the city of Detroit, and I have to be the Detroit Caucus chair, making certain that the community has access to funding to be able to afford these homes that we're talking about building, that we're talking about doing all of these. And then the truth of the matter is, before we got here, we told the young lady that I happen to be a licensed ordained minister, and he's the son of an ordained minister. And I look at things through the lens of Scripture, and it talks about taking care of the least of these. The least of these aren't people who are less than us. There's people who have fewer means. So when we talk about engaging the community, the business community, we're looking at ways to be able to subsidize housing. We're going to have subsidized housing. Everybody's not going to be able to afford $2,000. I have a young person who's paying $2,000 monthly rent. I said, sweetheart, that's $36,000.
Need to buy a house.
You know, I had that entire conversation with this 27-year-old.
I've done the same recently.
It's time to buy, but at the same time, we got to be certain that the banking community is going to want to give you the loan to be able to purchase that home and save yourself and be able to have those tax write-offs and all of those things.
The lack of available housing is a workforce retention problem.
Absolutely,
You know, prior to serving in the House, I served on the county commission in Kent, and one of my strongest allies there and now in the House on tackling housing affordability is our local chamber in Grand Rapids, working with the folks there to expand the suite of tools available to build more housing. Whether that's the Affordable Housing Revolving Loan Fund we created in Kent County, whether it's the expanded uses of tax increment financing that was done last term, whether it's the affordable housing tax credit that Governor Whitmer put forward in the State of the State. We absolutely need to create more tools in the toolbox to create housing at all price points so that we can retain employees, so that we can engage with the business community, so that we can engage with the development community and come together to tackle an issue that's affecting all of us.
That's the key. The key is come together and negotiate.
Yeah.
Because, you know,
of course.
some of our proposals are giving some of our local communities heartburn, right? And we're like, but there are pros, and there are so many good pieces that I'm certain we're going to be able to find some consensus on. If it's just a matter of transparency, we talk about that uncapping. It makes no sense that somebody would buy a new home and not have any idea that the taxes aren't going to be what they were when this resident was living there for the past 30 years. They're going to change. You need to know about that as you're working on your budget.
Yes.
So those types of things play a big role too.
Yeah. Well, we've conquered childcare. We've conquered housing. Everything comes in threes. What's the third issue you want to conquer this fall?
I mean, certainly, and this fall and going forward,
And
right?
of course,
You know,
into the
look,
future.
our vision project was built to show folks what House Democrats can do, also not just in the minority, but as the governing party, because I think we're primed for that in 2027. Affordable health care. Look, we're seeing folks who are struggling with the high cost of
I
prescription
see
drugs.
affordability matters all over this place.
100%.
I've heard.
Whether that's the access to affordable prescription medication, prescription drugs, but also, again, trying to shore up affordable health care and Medicaid due to the devastating cuts caused by the big, beautiful bill. You know, whether you are someone who's on Medicaid yourself or not, you are affected by this. You're affected by it because some of your loved ones might be. I have a sister-in-law who is an adult with disabilities. She is served by Medicaid. But on top of that, we also, you know, it impacts our entire healthcare industry. You know, the Michigan Hospital Association shared in their report that if we allowed these cuts to occur at a more torrid pace, it would risk 20,000 jobs in our state. And as someone who represents Kent County, where our healthcare industry is a key employer, that would have been devastating to our local economy and to affordable healthcare. So it's figuring out how we can rein in the cost of prescription drugs and also how we can defend affordable healthcare from the onslaught of cuts from the federal bill.
And it's critical in Detroit too.
I was just about to say, of course
Yeah.
it is. Yeah. We've got to do those things. And that's what we're laser focused on. We will do that. You can't have a healthy community unless you have healthy people in it. So we're laser focused on
Yeah,
that.
so important. Well, we've got a minute or so left. You want to each have a couple closing remarks?
Look, Representative Young was so apt to bring up our vision project. You know, we spent much of last year going out into communities across this state and asking, what do you need us to work on to make Michigan more affordable? And we have our Better Vision for Michigan, which you can see at housedems.com, showing folks that this is what we're ready to tackle. This is how we are going to bring down costs. This is how we're going to make Michigan more affordable so that you can not just get by, but thrive. And, you know, looking forward to moving that agenda forward over the next 6 months, but then for years to come and in the coming term.
Last word?
I've got to add, I know we said 3, but education, quality public
Okay, well, it's
education.
hugely important.
We
Yes.
have to focus on that. We talk about
We need
going
another
on-
15 minutes.
I know we would. I mean, just for education alone, but I
Yeah.
couldn't leave without
Right.
lifting that up.
Appreciate that. Yeah.
Thank
Thank
you.
you. Thank you
Yes.
both for being here.